Good morning. Today I will talk about the most common arthropod-borne vector disease, the dengue. The dengue is a worldwide febrile illness and making the maximum number of fever cases worldwide with malaria. So there are two very common vector-borne disease worldwide. One is dengue and other is malaria. In this lecture, I will talk about the dengue. Dengue is a viral disorder and caused by a virus of the Flaviviridae family. The dengue is caused by a virus known as dengue virus. Dengue virus is virus of Flaviviridae family and genus is Flavivirus. There are 4 serotypes or subtypes of the dengue virus or this Flavivirus. This is an arthropod borne, so arbovirus disease. There are 4 serotypes or subtypes of the genus dengue. They are DEN1, DEN2, DEN3 and DENV4. So there are 4 serotypes or subtypes of the dengue virus: DEN first or 1, DENV2, DENV3 and DENV4. The serotype 2 is the virus causing the most fatal febrile illness, and the most epidemics are caused by DENV3, that is the third category of the serotype of the dengue virus. In recent researches, a fifth DENV5 has been detected. In 2013, one more serotype of the dengue virus has been isolated from the autopsy samples, the serum, the plasma and CSF. So dengue is an arthropod-borne disease, arbovirus, and it is caused by the dengue virus of family Flaviviridae and the genus Flavivirus. It is having mainly 4 serotypes, but in recent researches, fifth serotype has also been detected from the autopsy samples and the serum and plasma. So there are some subtypes or classes, or I can say stages of the disease. The dengue virus can cause a very simple febrile disease, or it may cause the more severe form of the disease, the dengue hemorrhagic fever. So it can cause the 2.5 billion population of the world in 110 tropical and subtropical countries are at the risk of the dengue. 2.5 billion. And about 70 to 300 million population is infected by the dengue virus yearly, and several thousands of people are suffering from the more severe form of the dengue hemorrhagic fever. So there are 70 to 300 million cases of dengue occurring per year, having the infection which may be asymptomatic, may be in form of febrile illness, may be in form of severe dengue infection, the dengue hemorrhagic fever, or maybe in form of very fatal disease, the dengue shock syndrome. So cases are increasing day by day due to increasing travel history, due to consequences of the environment, due to the urbanization. So traveling, consequences of the environment, and due to the urbanization. The cases are increasing year by year due to increasing travel history, maybe due to urbanization, maybe due to the environmental consequences. So dengue may be in form of classical dengue fever, dengue fever, may be in form of the dengue hemorrhagic syndrome, DHF, or it may be in a very, very fatal disorder where the symptoms and signs of cardiac failure and the kidney dysfunction or kidney injury, dengue shock syndrome, known as DSS. So dengue may be seen in form of asymptomatic infection only, may be in form of classical dengue fever, or simply it is a febrile illness, more severe in adults, and it is not more severe in children. In more severe cases, it is in form of dengue hemorrhagic fever, and it may be in form of very fatal disease, the dengue shock syndrome, where mortality is more than 50%. First of all, I will talk about the classical dengue fever. It may start from the prodromal symptoms like cough, conjunctivitis, coryza, malaise, and prostration. So first of all, I will talk about the classical dengue fever. It may start from prodromal symptoms like conjunctivitis, retroorbital pain, headache, and the cough, coryza, and the malaise and prostration. So, signs and symptoms are headache, retroorbital pain, retroorbital pain is also seen in the diseases affecting the middle meningeal artery and in case of anterior and middle cerebral arteries. The third symptom is the severe myalgias, which are more commonly seen in the neck, the lower back, the upper extremities, and the lower extremities. So, severe myalgia of lower back, upper, and lower extremities. Arthralgia, pain in joints, especially the elbow joint and the knee joint. And the bone pain. It is due to the invading virus destroying the bone marrow, and it is seen in all bones, and the fever is also known as break bone fever. So dengue is also known as break bone fever. The other symptom is nausea and vomiting. Diarrhea is rare in dengue infection, but the nausea and vomiting are commonly seen in patients of dengue fever. Weakness, prostration and weakness, altered taste sensation, altered taste sensation, anorexia, lack of appetite, and The some other symptoms like insomnia, mild hemorrhage, it is seen in form of epistaxis, hematuria, menorrhagia, that is excessive blood loss in menstruation, and there may be GIT bleeding, or it may be subcutaneous hemorrhage in form of patches. There may be isolated patches on the flexure parts of the body. In classic dengue fever, there is only mild hemorrhage. When this hemorrhage becomes moderate and severe, this form of disease is known as dengue hemorrhagic fever. And the lymphadenopathy, so these are the signs and symptoms of the dengue classic fever. Maybe severe headache, retroorbital pain, pain behind the eyeballs, severe myalgia affecting the lower back, upper and lower extremities and neck also, arthralgia affecting the elbow joint and the knee joints, bone pain affecting almost all bones of the body, nausea and vomiting, weakness and prostration, altered taste sensation, anorexia, that is loss of appetite or lack of appetite, insomnia, mild hemorrhage and lymphadenopathy. These are the signs and symptoms of the classic dengue fever. When there is moderate or severe blood loss, when there is loss of plasma and loss of blood, this form is known as dengue hemorrhagic fever, DHF. Besides all these signs and symptoms, remember all types of dengue fever, either it may be dengue classical fever or it may be the dengue hemorrhagic fever or it may be dengue shock syndrome, are having sudden onset of fever. These all starts from onset, abrupt or sudden onset of high grade fevers, especially in adults. In younger and in children, the fever is not very typical, but it may be in form of simple febrile illness. But in adults, it is having a typical presentation in form of sudden onset of high grade fever. After the subside of fever, after 2 to 3 days, a convulsion period of 2 to 3 days, then fever reappears. This is known as saddle back phenomena. The fever may be due to the same strain or same serotype, or maybe by different serotype. If a person is infected by type 1 serotype and reinfected by type 1, may lead to hemorrhagic consequences or manifestations of the dengue fever. But when the serotype is other than 1, that it may be 2, there will be more serious form of the disease, especially in case of type 2. It is more fatal and serious form of the disease. So after saddleback phenomena, especially in children, especially in female children, there is loss of blood, it may be in form of hematuria, in form of GIT bleeding, it may be in form of subconjunctival hemorrhage, or it may be in type of the subcutaneous hemorrhage, or it may be in type of menorrhagia, in form of menorrhagia in young and adult females. So there is history of the blood loss, profuse vomiting, pain abdomen, please don't ignore the patient when you say who is having pain abdomen and profuse vomiting, restlessness, when all these are seen, symptoms and signs, and these are accompanied by the signs and symptoms of cardiac failure, cold extremities, tachycardia. Tachycardia is seen in all forms, but it is more serious or more severe form in the dengue shock syndrome, kidney injury, that is oliguria, it is having the capillary leakage, it is known as DSS.